Welcome to this edition of the First Aid Show. Now there are times where, as first aiders, if we're doing rescue breaths on someone, we're unable or unwilling to actually deliver the breaths. So what we're going to do now is have a look at the bag valve mask and how to use it when resuscitating someone who's not breathing. A good way of getting ventilations into the patients using the BVM, the bag valve mask. Can you just go through the components of the BVM first?
Okay, so this is your bag valve mask. You would connect it to oxygen, and the oxygen would filter into the system and put into the reservoir bag here. So as you deliver a breath to the patient, you're giving them as much oxygen as you can possibly manage. You have a compressible bag here that will provide the oxygen to the patient. As you breathe, gives the breath, and as you bring it out, you can hear the noise coming in as it's sucking the oxygen into the patient. So that as you actually breathe to the patient, the valve opens up and delivers the oxygen. You place it onto the patient's face, ensuring that you have a very good seal across over the nose and onto the chin, making sure that the seal is just to the base of the chin so that you have a good seal. You need to open up the airway completely, so you needed to open the head with a head tilt, chin lift, or open it fully to extend the airway. You need to ensure that you're pushing down on the face mask to achieve the seal, but at the same time not squashing everything too tight. So with these three fingers, you'll pull the airway, the chin up to give you the airway opening, and then with this hand, you can produce the breath. You probably can notice there is a gap around the face mask, just probably at the base or along this side, because I'm only using one hand, and I'm using the other hand to provide the ventilation. So we recommend a two-man technique so that I am able to hold completely onto the face, open up the airway, and then somebody else is able to compress the bag to deliver the breath. That's why we do a two-man technique. Okay, James, what we're going to do is show you how to use the bag valve mask. Okay, so as we've said, you need to place the mask on top of the patient's face. It's identified for it looks like a face. It's easy with a two-man, so you're able to, with both hands, if I take that out of the way, hold on to the mask, pushing down slightly. Put your fingers under the chin, bring the head up in that position, making sure that you have a good seal around the face with two hands. At the same time, I'm going to ask you to squeeze the bag. Okay? So when you squeeze the bag, you always make sure you only use one hand. If you use two hands, what you'll do is you'll cause trauma to the lungs, and you damage the lungs, and the ventilation becomes a lot more difficult in the future. So one hand is all you need. So I'll hold the mask on, open up the head, the airway, one hand, you see the breath.
Yep.
Okay, so again, good seal, open up the airway, one breath. Okay,
Yep.
So we'll swap, and you hold the mask,
Okay.
and I'll do the breathe for you. And that's it. Open up the airway, and when you're ready,
Yep.
one breath. If you open the airway very slightly, that's it. One breath, and that's it. Okay.
Yep.